As we mentioned before the break, our health news tonight concerns back pain, the fifth most common reason for doctor's visits in this country, by the way. Of course, every case, every back is different. No two people are alike. But a big new report says a lot of doctors aren't following the recommended guidelines to treat it. That leads to setbacks and wasted money. We get our report tonight from our chief medical editor, Dr. Nancy Snyderman.
Nan Coffey's back has been bothering her for 2 years.
I feel it more when I'm sitting for long periods of time.
She's one of 66 million Americans trying to manage back pain. But a new report reveals when it comes to treating it, more doctors and patients are getting it wrong. They're not following the established guidelines, like first using over-the-counter pain medications and anti-inflammatory drugs, holding off on tests like MRIs and CT scans, and doing physical therapy exercises before resorting to surgery. Instead, people are increasingly turning to stronger and potentially addictive narcotics. There has been a 50% rise in the number of prescriptions since 1999. The study also reveals advanced screenings and referrals to specialists have gone up, despite recommendations to treat back pain conservatively.
We live in an instant fix society. Everyone is busy and you want to just click on it and be done with it. Most people, all of us, don't want to wait to get better.
Dr. Mark Weidenbaum says most people with back pain who follow the recommended guidelines will get better on their own in about 3 months. Still, there are certain signs a more aggressive approach may be necessary.
Severe pain and progressive neurologic changes, that we really have to pay attention to.
That's exactly what happened to Nan's husband, John.
Just got worse and worse. I tried to take everything that was in the medicine chest that would cut it, but nothing really worked, so I went to my doctor.
An MRI confirmed a pinched nerve, which was not responding to conservative therapy and put him at risk for permanent damage. Now, occasional steroid injections keep him comfortable. For Nan, taking over-the-counter medication as needed has been enough, but her husband gives her credit for handling pain better in general.
I'm a big baby. She's not. But, women are much more adept at pain.
And all joking aside, there are gender differences when it comes to how well we handle pain, both physically and psychologically. Brian, women handle pain better.
All right, no comment on that. But, Nancy, my question has to do with this. Is anyone talking about prevention?
Yeah, prevention's a big thing, and it comes down to this. The stronger your abdominal muscles, that core group of muscles, the stronger your back is going to be. So increasingly, I think men are migrating away from upper body strength and a lot of weightlifting into the classes where you've seen women for years. Yoga, Pilates, sometimes even dance. And don't forget to stretch. The more limber you are, the less likely you are to injure your back, too.
Nancy Snyderman tonight on back pain, and it turns out gender differences. Nancy, by the way, at our station in Louisville tonight. Nancy, thanks as always.